have Dr. Edwards and also Stone Edwards and Sydney, who are here in the room with us, visiting us. And this presentation that Dr. Edwards is about to make is part of the visit that she has had since Friday. And we had, and she will tell you a little bit more about what happened on Saturday as well. But as I mentioned, Dr. Edwards is a nationally recognized expert on many things, including health equity, but also in the topic that she's going to be speaking about, which is diversity, equity, and inclusion and accessibility as well. And you have a little bit in the flyer that all of you saw, a little bit of her background. But very quickly, she is the Associate Dean for Community Engagement and Government Affairs at the Kaiser Permanente Bernard Tyson School of Medicine, where she's also a professor in the Health System Science Department. She's responsible there for leading efforts to bring the school into the community and the community into the school, which is so necessary. And she's an expert on doing this. Many things to learn from her and her experience there. She does it through teaching, through practice, outreach, engagement, service, and research. And in her role, she leads the Office of Community Engagement, which is implementing a 3-year roadmap for conducting community engaged work within and outside of the school. And Dr. Karen Edwards is a nationally recognized expert, as I mentioned, in community engaged research and clinical and translational science. We have been working together for many years, along with Lloyd Michener, who I'm hoping that he join us. And if you join us, Lloyd, you are most welcome from Duke University. And she was a contributor also to the National Health Disparities Plan. And we were just talking about it, to the second edition of the CDC Principles of Community Engagement, a landmark contribution to the field. And she has published extensively, and she has included case examples as impact stories, for example, in the recently released work. This is a landmark work also by the National Academy of Medicine, assessing meaningful community engagement in health and healthcare. So, Lori, what a distinctive pleasure is to have you here. So take it from here, and also, and I'm going to shut my audio very soon. Also, Edward and Sydney, welcome.
Thank you. Thank you so much. And
I'm really pleased to be here, and I thank all of you for joining. And it's been a wonderful trip. And what I'd like to do is just share a little bit about what we saw on Saturday. Stone, who is a research assistant at UCLA, working with some of your colleagues at UCLA, Keith Norris and Arlene Brown, the Amani Clinic was a wonderful visit, and you'll see the pictures there, and hopefully you all can still see them. Let me know if you can't. But we had a great visit, and we at KPSOM are trying to continue our new work with the student-run clinic as well. We don't have access to undergrads the way that UC Davis does, but we've learned so much, and it was so well run, and it was amazing to hear that you have 7 different student-run clinics, which is unbelievable, and we're hoping to learn from you as well. I do know that while we were putting ours together before I arrived at Kaiser Permanente School of Medicine, Maureen Connolly and Rose Rodriguez, both with whom I work, did a lot of work with trying to find out what other schools were doing and included UC Davis. So it was nice to actually physically be present and meet such wonderful people. So thank you so much for all of those who helped to make that happen. I'd like to give you a few caveats before I start because you are a leader in this space. So we're not going to go through what the definitions are of health disparities or make the distinction or make the charge that we know what the problem is, nor are we going to talk about the part of institutionalized racism and trying to make the argument for that. This is an institution, you are an institution that understands that. So what I want to do is present to you as leaders and what you can be doing as the next step as a national leader in institutional transformation so that you can continue to do the work you're doing and be a model in that space. We'll explore ideas for further individual as well as collaborative reflection and discussion. So after this, hopefully you'll be able to go back to your groups and collectively as well as individually start thinking about some of the things that I'll talk about. We will emphasize system challenges and solutions. And we acknowledge that these are complex. There's no answer to all of this. So this is in a short period of time, I'm not going to be able to cover, nor anyone be able to cover these complex topics. But please do ask questions at the end. I will leave enough time for that. So the objectives of today are to define institutional transformation, because that's where we need to be at, is we know what the issues are. We know that these things are done at the individual level. We're siloed. How do institutions transform themselves in a measurable way in the context of DEIA? I'll describe the DEIA learning system accountability framework that the DEIA task force at the CTSA consortium level developed, and we're using that now within the enterprise committee. Discuss reasons for the discomfort in addressing individual and collective challenges to a DEIA integrated transformative institution. There are probably people across the institution that are doing DEIA work, but is it integrated? And that's the challenge, that's the charge, is how do we collectively work and thread this throughout the institution? And then explore potential ways to build DEIA transformative institutional capacity. These are just ideas, hopefully to generate some discussion and possibly the challenge you have to me and to the leadership team for the Diversity, Equity, Inclusion, and Accessibility Task Force at the CTSA consortium level, which I co-chair with Shakita Collins from Texas. So what I'm going to do now, there are 3 different polls. This will take us about 7 to 10 minutes, and I'd love to get your feedback on 3 questions. We're starting with the first one. When you think of institutional transformation to address DEIA in translational research, what keyword comes to mind? You can put in that, put the URL into your computer, or you can text Lori Carter Edwards 188 to 22333, or you can use the QR code. I'm going to give you a second to look at these, and then I'm going to leave this screen and go into the poll so we can see what you have to say. But what keyword comes to mind? Even if we don't know what institutional transformation really is, you've thought about these things because you hear it often. What word comes to mind? And I'm going to escape for just a second. Let's see. Okay. Okay. So I put this screen up so we can see what your responses will be. When you think of institutional transformation to address DEIA in translational research, what keyword comes to mind? Are you able to see? Is people able to see it? Great. It should work. Let me see. This is the one that's active. So
Lori, the link is active on my laptop, but I'm not, and it says it's submitted, so hopefully you're getting it.
well, it should be. I'm gonna go ahead. Let me deactivate and activate again. Let's see. Okay, I'm gonna activate this one again. Thanks, Lloyd.
Lloyd, Lloyd, I'm so pleased that you are with us.
You can speak up.
I got a response here just to see.
Okay, let me see. Oh, okay, but it doesn't show. Okay, so here it should have made a word cloud. So forgive me that the word cloud's not working, but you see your responses, everyone. We see progress, collaboration. Thank you, Song. Equity, transformation, leadership, systems change, representation, community, large organization changes, again, progress, system-wide, resistance, slow, which we know this is what happens when this occurs. So those are those responses. Thank you so much. And I'm so sorry that the word cloud didn't work. So I'm going to go to the next question and hopefully we'll see better results. Okay. Let's go to this question and hopefully this will now work. I don't know why it didn't before, but okay. So in 1 to 3 words, what would you say is the greatest need to be met for your institution to be a DEIA integrated transformative institution? Try present. Thank you. Thanks. In 1 to 3 words, what would you say is the greatest need to be met for your institution to be a DEIA integrated transformative institution? And forgive my technologically challenged self. It's interesting how listening and leadership and institutional are the primary words, but listening is a really important word for this. And I will save these word clouds and give them to Sergio so that you have them for your institution. Community, action, buy-in and diversity. Those are some of the other words. Recognition, which is really important as well. Thank you so much for your feedback. Oh, let me keep this. Wow. Okay. And just keep putting in your answers. I think this is really great. Okay. Support, champions, outside. And I'm going to mention all of these things that we're talking about, which is really great. Okay, and now I'm going to try to get out of this screen, I think. Okay, so now let's go to the third poll. And you can keep putting in responses, but let me go to the third one. Thank you, Stone. I forgot that I had to press present. Okay, so now this last one is, how confident are you in your institution's ability to be a DEIA integrated transformative leader? Okay, I'm sorry that the screen's not showing it all together. Okay. Keep putting it in. The fact that we have a distribution curve is important. You know, it's telling. I believe one of the reasons for taking this approach to sharing with you, and there may be some others who are on the call like Lloyd and others who may be from other institutions, and you may be representing those, but you serve as a leader at UC Davis. So where do you need to go in this next phase? Because there's certainly things that can be done better in terms of how to integrate across the institution. And that's what the focal point will be for today. So we basically at 53% that said highly confident, 29% moderately confident, and slightly confident 12%. And we do have 6% that have said non-confident. So again, I will share these results with Sergio. But thank you so much for completing that poll. This was really helpful. I'm going to go back to the slide deck, and thank you so much. We're going to just go ahead and keep moving. Thank you so much, everybody. Sorry for all of the challenges I'm having. Okay. So let me go ahead and go to, you're going to see the next slides. So just bear with me as we go through this. And eventually, if it pops up, we'll go through this. But I want to talk to you about institutional transformation and what we think what this is. So this is the process of making these fundamental changes in your institution's operations and culture. And what this, I mean, those of you who understand this and have worked in this transformative space, it's the ability to be adaptive. But typically for institutions, this work has been done at city planning levels, not necessarily in academic institutions, has been at the higher education level, but not necessarily in translational research do we talk about this. And there is work, as I mentioned, on campuses, but it's primarily for undergraduate education. It's not about how we should be doing healthcare research. And so we should be thinking about this more. It involves changing the impact of the environment outside of the institute as well as inside. And so we're trying to disrupt these norms. We're making things very uncomfortable, but using this utopian thinking where we're trying to basically achieve what we think should be this space that we can be in to be the best institution that's really addressing DEI and A. But using a plan theory and planned approaches. And that's what we don't do. We don't spend a lot of time in the processes of this space of transformation. Right now, the CTSAs are charged with studying the science of translational science, which is the process of studying the science. It's similar in that space to try to really understand our processes. And the aim is to understand how institutions learn and adapt so that they can be better designed and managed. And a lot of this work, as we think about adaptive or transformational leadership, comes from the Harvard group from Heifetz, Grashow, and Linsky in terms of adaptive leadership. And for DEIA, institutional transformation, we're talking about dismantling and innovating simultaneously. How do we do these together in that space? I want to just quickly show this to you, even though this is for university presidents thinking about primarily in general education, but not necessarily transformational research. But 71% of university presidents in the Inside Higher Education survey say that their institutions must fundamentally change their business models or other operations. So they think about this often from this business framework, but we have to understand the context of culture if we're really trying to understand how to change business, the business framework. And in terms of race relations, if you look at these two bars, the first one basically is, generally speaking, would you say the state of affairs on your campus is excellent, good, fair, or poor? And while university presidents primarily felt that they were good or excellent, when they were asked the question, would you say the state of race relations on college and university campuses is excellent, good, fair, or poor, they had a more negative rating overall. So they rated their institutions higher, but they felt that there was this issue across the board. What does that actually mean in terms of the dichotomy of how they're reporting out, which also we saw in the CTSA leadership diversity survey? What does this mean in terms of the climate, and how responsible are institutions who are doing this well to be a model to other institutions if we're talking about systemic racism and we're talking about systemic bias? So those who are transformative institutions, they typically aspire to be change agents, which UC Davis is one, often outside of the institution, not just inside. There's this culture of belonging, and many are developing competencies around culture. What does that mean? There's involvement of other departments and colleges and schools, but how do we create this culture of belonging to change the workforce so that there's this acceptance and we're reducing implicit and explicit bias? creating disruption for the sake of progress. Some people believe that disruption is problematic and that there's not a goal in mind, but transformative institutions have an actual goal in mind for disruption. To identify, implement, and evaluate meaningful, impactful efforts, which Sergio just mentioned with the National Academy of Medicine, assessing meaningful engagement is one step towards trying to actually measure and implement efforts. To be innovative and adaptive, and to hold people and their collaborators accountable. We don't hold ourselves accountable in a measurable way, and this is what transformative institutions do.
There is a question in the chat about what year is the survey from?
The DEIA survey, is that what, if you're asking
Yes.
about that, we did that survey in 2022. And so we presented this at the national level in 2023, and I'm about to show you, I'm only going to show you one result. It's the framework that has been developed with the enterprise committee. That is what I want to focus on for today. And again, I apologize for you guys seeing the slides and it's not me not getting this done right, but what I'm going to now talk about is this learning system accountability framework that the DEIA task force developed as a result of their work for the year that we were required to provide support for the CTSA, that then led to the enterprise committee that now exists. In this, we did provide definitions in the paper that was published this year, excuse me, in 2022 on what leadership diversity approaches we were taking. And we wanted to give definitions to center everyone about what we were thinking of in terms of diversity, equity, inclusion, and accessibility. In the interest of time, I'm not going to read all of those definitions, but what the key here is that this is about recognition and accountability. If you look at these definitions, many of them are ones that we've already used, but this is to set the stage for what we hope are definitions that we can collectively agree on. We haven't had that discussion yet. Do we agree as a CTSA consortium on these particular definitions, or do we want to refurbish those? And I will tell you right now that the CTSA, the DEIA Enterprise Committee, we're working on the mission and the goals and the values, and we're going to finalize those on the 14th of December for those of you that may be representing your CTSA or UC Davis as well. And so we will finally have a mission statement and be able to start working towards activities, including this could be to refine these definitions. In this leadership survey, diversity survey, the focus was on diversity rather than equity, inclusion, and accessibility, because we felt that the CTSA sites had an opportunity to report out on leadership diversity easier than the other topics. And we felt that we needed to collectively gather data for the other topics before we started to create an assessment. I will say this as well, when you've seen one CTSA, you've seen one CTSA. So we realized that some people were very frustrated in completing the survey because we weren't giving any definitions. We needed to see what was going on across the 60 CTSAs that completed the survey, which was 95% of the CTSAs, which we're very pleased with, who completed this. But our goal was to try to create this aggregated baseline, since this has not been done before across the consortium. Again, UC Davis thinking about being a leader in this space in institutional transformation. So let me go on and share with you that our survey methods, what we did is we used a mixed method approach where we had qualitative and quantitative data collection. And the hub was the unit of analysis, though we know that some of the CTSAs partner with other institutions. The hub was the unit of analysis. The partnering institutions had an opportunity to complete the surveys as well, and those data were incorporated for that particular hub when they return their data. At the time, Rochester was the honest broker for the data. None of us know who completed what survey, and we kept that in anonymity present to respect people's responses. And we covered these 6 domains that you see, and those data were collected from August to November, as I mentioned, in 2022. Demographics, infrastructure, the composition of community, perceived representativeness, diversity of the CTSA, and a DEIA dashboard. We asked a series of questions in those spaces. I will say this in terms of the assessment. The denominator for each institution was the population in which they served. So if you served a local population, when we're asking about leadership diversity, is your leadership reflective of the population that you're serving, whether you serve locally, state, or national? Some serve national and state. So they had to consider those data as they were completing the survey, which made this complicated, but we feel that we got some really decent responses. I'm only going to show you one of these, and again, while leadership reported by these sites was roughly half for female and male in terms of leadership, less than 10% of leadership across the CTSA consortium reported less than 10% for either Asian, Blacks, Latina race, and ethnic groups. And so, yet some of the populations that are served represented much higher percentages than what you see in the leadership team for each of the CTSAs. And leadership was defined by the institutes, and there are data that has been presented nationally, and if you have questions about that, I can provide that later. But I just wanted to give you a smattering of information from that survey.
Dr. Carter?
Absolutely.
There's a quick question in the chat, if you can define what you mean by hub.
So a hub is one of the institutes that received funding from the National Center for Advancing Translational Sciences. And again, there are 65 in the nation, and a hub is one of those institutions. So UC Davis is a hub, Duke is a hub, UNC Chapel Hill is a hub. We have, I think there are about 8 or 10 in the state of California, just to use that as an example. They may partner with minority serving institutions or organizations, but they work with the hub, and the hub is the academic medical institution that received the parent grant for the CTSA funding cycle. Any other questions, Vanessa, in the chat?
That's it for now.
Thank you, and just ping in. And diversity of the CTSA institution, just wanted to share with you that while you saw those data on the leadership diversity for race and ethnicity being less than 10% for most populations of color, you see that what they're saying here in the CTSA, whether they represented their local area, while 60% basically said well or very well in matching their local area, that was for CTSA. So basically only 60% are feeling that they're representing that. So there's room to make changes. And for institutional diversity and matching and reflecting the representation of the local area, it was higher for the institution. So we're talking about close to 71% for the institution, but there's still room where we're not representing the local area. And this slide, compared to what you see, these are things that disconnect. It's something we have not yet unpacked, but it's something very important for us to understand. And it's not just for us to identify that to count race, to count by race. It is, what does it represent in the grander scheme of things when we think about workforce, and we think about, we know that data show us that that racial concordance can matter, not only in the clinical setting, but also in the research setting. And if we're really interested in doing a better job of this, we have to look at these data and look at them seriously. Wanted to quickly show you the team that we have, that our leadership team, we've been meeting since January of this year, and we're the newest of the enterprise committees. We're the 5th Enterprise Committee. And we have 65 voting members and about 87 people that are on the distribution list that attend our meetings. So we're really glad that we have all 65 institutions represented, even though some institutions are experiencing difficulty in attending some of these because of some of the issues that are going on in the country. They do have representation nevertheless. So I'm going to quickly go through this accountability framework. This is published in last year's Journal for Clinical and Translational Science. And what we did is we took the information that came from the 2020 fall CTSA meeting, for which Sergio was heavily involved. As you see, he's one of the authors for the 4 focus areas, which is the middle part of this framework. And we took that and we basically developed ad hoc groups within the task force before the Enterprise Committee to try to flesh out what these may mean. And that slide is not here, but I can provide that information for you at a later time in the interest of getting done early. What I will say this is that what we realized as we were looking at the focus areas is we were saying, how do institutions decide that they're going to work in a particular area? What is one way that we can basically try to center the work that's being done so that we're working from a set of principles, just like their principles of community engagement? What are some DEIA principles as you, as an institution, think about any one of the topics that you want to try to focus on? So we came up with accountable, feasible, meaningful, flexible, and equitable as principles that any of your projects should have. You choose a focus area, and then the action cycle is an approach that you can use for continuing to identify, design, and implement what you want to do for a project based on the set of recommendations that you have. So I'm going to go through this quickly. I talked about the 5 principles, and the purpose of these principles is to drive your collective selection process of the element that you want to work on. So while you may be an institution that works on a variety of things, what is one that you as an institution will want to work on that you can share with the CTSA? Excuse me about that. So when you're deciding, your institution may decide that there are 5 people who are trying to say, we're going to work on one particular area. There may be 5 investigators that want to work on it, or there may be different groups that want to work on these spaces. When you're making the selection for what you're going to invest and put resources in, is the element that you're interested in, the topic, is it accountable? Is it meaningful? Is it feasible? Sometimes it may be accountable and meaningful, but it's not feasible. Is it flexible? That's a key area in the work that we're doing, is to be able to shift on a dime. And that's one of the things we don't do very well, is we're not flexible as scientists, and we're trying to learn how to do better in that space. And is it equitable? So are we fostering an environment where our stakeholder community voices are heard, particularly in this, because we're working to try to change the condition of communities, community partners, and community members. The 4 focus areas, which we talked about, those came out in the work that Sergio and others, Ebony Bulware, had done. These 4 areas you see, and I'm going to move on. And then the cycle. And the purpose of this is to use it as a guide to translate principles and focus areas into action. And you see those from the concept of assembling ideas and suggestions, identifying aims and objectives, prioritizing and balancing short and long-term objectives for that topic, developing directed steps, translating the objectives to actionable items, and then map the promising practices after you're doing that work, and evaluating that progress and impact so that we can share this with one another, so that we can continue to build on the dissemination and implementation of these best practices across the country. I wanted to go through this example. If we were to apply the framework, imagine this illustrative example of infusing a community-engaged DEIA training requirement program for all researchers affiliated with your CTSA hub. So let's say that's what we want to do. So because of the nature of that particular goal or element, we think that for programmatic, topic area, focus area would be the most appropriate to address that. And so in that programmatic area, what do we want to do? Well, we want to build DEIA into the research teams. That's how we want to try to infuse. We're going to try to infuse by doing this work. And then the recommendations and suggestions are to require some basic training and optional advanced training for research teams. Then you have a set of programmatic aims, as you see there, where we want to increase trust, we want to increase DEIA competencies for people, and we want to build a program or a quiet program for researchers. So this is all a project to increase DEIA using the framework to make it accountable. You have short and long-term goals. You may have an IRB module. You may have joint trainers. You may create action learning modules, a variety of things you may do. The directed steps could be to connect with hub leadership, which is critical, the institutional IRB, a community advisory committee, and hub cores to lead and guide the vision as you design this. So it's iterative. Actionable steps, convening a planning team to identify priorities, conduct an assessment using a strategic plan that has a smart timeline, and then implementing those activities. And then whatever works, the lessons learned, you map those promising practices for your institution, but being prepared to share that across the consortium, and then evaluate your process and impact. And so these are all ways that we would try to be accountable and create this learning community within your institution, but also across institutions. And just to share with you in terms of making sure that this is accountable, this is a back step, but you can see those 5 stages there, that the definition like for accountable, it would be the hub leadership and relevant staff will ensure that researchers will adhere to the requirement. How is that done? Researchers will be accountable for implementing what they learn and to improve their relationships in their research design. That could be part of the planning phase for your CTSA. Sorry about that. They could, whether it's meaningful, you got to involve the partners to try to figure out whether your work is meaningful. I mentioned feasible, flexible, and equitable, and all of those would be tied to trainings because that's what the overarching goal was, to infuse this community engaged DEIA training requirement program for all researchers within our CTSA hub. This is just one small example to how to use this very complex framework that requires quite a few people to make this happen. And if we are integrative, we can do that. So let me quickly go through institutional and transformational challenges. I'd like to put these 2 quotes up here. All progress is left up to the unreasonable person. So hopefully people on this call, if you're not the unreasonable person and there is someone who's unreasonable, how are you going to work with the unreasonable person that makes it difficult to change and make progress? And if we don't understand the cultural differences that are within the UC Davis system, within the UC Health, within the CTSA, let alone the community partners, then we can't understand each other. So while we may be frustrated for someone who may not be reasonable, it is our responsibility to be able to use a variety of tools, whether it's appreciative inquiry, whether it's a series of tools to bring that individual to the table to help them understand that this is a collective necessity if we're intending to improve the conditions of our institution. And I will stop and say this, because I am working directly with Joni Rutter. Our paper just been accepted for clin trials in DEIA, and Mike Carilla. They are very committed to DEIA. So if there are people that are part of your institution who don't understand this, they need to understand that the leadership of NCATS, which provides the funding to us, they are very committed to DEIA. And in fact, they've just hired a inclusive science officer at NCATS. So we're going to have a chance to meet her as well as the collaboration engagement EC. Quickly to show this to you, because people they're early adopters and late adopters, but remember, all progress is based on the unreasonable. However, once the early adopters have adopted a process and then the vast majority of people come on board, We then plateau, and now we're ready for the next innovation. So an innovation window, when you're getting ready to do something different, is when you've hit the plateau of maturity for the particular topic. What that means is either the unreasonable person is left behind while you continue to move forward, or they adopt and adapt just by nature. They have to adopt and adapt. And this is how we have to work in terms of thinking about innovation. Who are the early adopters? Who are the people who are not early adopters, but are willing to work with the early adopters that then we can transform and make this innovation in DEIA and transform our institutions. So this is just an example to just pictorially, because I like seeing pictures to get us thinking about this. In terms of the adoption curve, the vast majority of people are late adopters or laggards. And one of the reasons is what I'm going to share in the next slide. But you see this adoption. Your institution should be thinking about who are the early adopters so that you can not only tap into them, but actually identify what their characteristics are so that you can possibly grow your early adopters and help the early majority to adopt these changes that are necessary. These are things we should be thinking about. But what are the problems in doing this? At the individual level, we have a fear of failure, and we are too afraid to fail forward. And if the institution doesn't provide an opportunity for failing forward, then it makes it that much more difficult for people to adopt. But our brains, because often this is tied to implicit and explicit biases where people really don't realize, and we all have implicit biases, that the brain is a prediction machine. This is not something that we should be considering as negative. We all do this. We are wired for threat identification. So what ends up happening is we're constantly seeking the path, the simplest solutions. And so when we're talking with individuals that are part of our team that are less likely to change, know that we are all going through this. There's some level of fear of adaptability because we're constantly wired for threat identification. Think about the community members that you're working with that are wired for threat identification and not wanting to work with someone at your institution because they're wired for threat identification as well. And so there are biases coming in both directions, and when you can't address those biases, then you can't move forward. But the institution also has transformational challenges, and there's this resistance to critical reform thinking. And you feel it may be too much to lose if wrong. And you're not yet desperate. When were we desperate? We were desperate during COVID, right? And at that point, we were forced to change. We saw us move and be involved with even the vaccinations. The CTSAs played a critical role in advancing and accelerating the clinical trials for the drugs that actually happen. But when you're not yet desperate, you don't feel the need to change, but then that means you're not visionary. And then we end up being reactive when we run into crises because we're not forward thinking. So these are transformational challenges that you, as UC Davis, who's an expert and also a leader, think about. These things will be really important. Ways to build, I'm on my last slide. Strategies for building transformational capacity would be to adopt intersectionality. These articles you can look at. They're interesting. This Patton and Hayes is quite interesting. It talks about looking at this from a Black female's perspective in terms of leadership and transforming institutions. But the whole concept of intersectionality is breaking down the silos at the leadership level, and also even within your own groups within your CTSA. Are you working more and thinking about threading DEIA versus thinking about this in a siloed way? Design thinking becomes very critical when you think about the slide that I showed, the early and late adopters and getting to the innovation. Design thinking is really a key piece. And we have tools in implementation science to think about design thinking at the institutional level. Institutional leadership needs to be having conversations and planning at all levels. You could have world cafes, we could have town halls, you can have these critical pieces to understand how to transform the institution, not just hear what the problems are, but hear what the ideas are, which the article by Kim and Marbonnier on fair process actually, Lloyd Mitchell had me use that article teaching the residents at Duke, using this article that people just want to make sure that their voices are heard. And if you do that, you can actually change the dynamic. Even if you don't choose what their interest is, they have to be heard. And actually, from a business model, in companies that actually did that, they increased their profit margin just by being fair and listening, which some of you mentioned in that word cloud. Investing in a DEIA strategic plan rather than creating reactive siloed solutions, which means there has to be this effort to try to do this integrated. Creating innovative opportunities for institutional employees to share ideas that can be quickly tested for proof of concept. NIH doesn't give us funds for this. And so some institutions, including UNC, we were talking about this, and I would imagine others, where the institution at the president's level provides seed money for opportunities to explore innovative ways where if you fail, you can fail fast, fail forward, but you are not expending your research dollars to do this. And institutions need to be thinking about that as well, especially working with community partners. Bringing in the community at large, we know about this. We know that some institutions have community faculty where they are actually considered and respected as part of the team, and then collectively embracing the discomfort that comes with change. I may be uncomfortable in a space, and Sergio may be uncomfortable in a space, but when we are talking together about our discomfort, that's when you can start trying to make the change by having these really tough conversations together. And while all of this stuff seems common sense, we are doing it. So that's why I wanted to bring this to the table. The one example, I thought this is my last slide. I apologize for this. We did this at UNC Chapel Hill, and I wanted to show this as an intersectionality example. And this is around fiscal readiness, and there's a paper that was published in 2020 around this. And I will tell you, in the paper that we published on fiscal readiness, when we looked at promising practices, barriers, and facilitators, the facilitators were in every category across the board, working with community partners, academic administrators, but the infrastructure was the only area where we had no one list of best practice. It's the goose egg in our paper. And that to me is the most profound piece of knowledge in our paper, is that there was no best practice listed for infrastructure. We have to change this, which means we have to think differently. And so this is just one very small example where I had a relationship as a member of our CTSA with the Vice Chancellor for sponsored research and with accounts payable with previous work on trying to ensure that there was a waiver for community partners to not have to submit their bank account numbers if they didn't have one. There had not been a ruling, and it was decided that it was mandatory that they had to have an account number. So we worked with accounts payable, and they basically added the language across the university that wasn't necessarily a requirement. That did not have to be a requirement for community partners. We then started working on the legalese, the 6-page the independent contractor consultant form that was filled with legalese. It was difficult for community partners to fill out, took a while for the for accounts payable or finance to get things. So we worked with accounts payable, we worked with finance, which also worked with legal. We worked with the Office of Sponsored Research, and we created a streamlined tool that now is used across the university, and it's a benefit to both the students and beneficial to both the community partners, to the CTSA, and to the accounts payable and finance. So we've helped try to change something that took 8 months to change one form, right? But now it's in the system, and we're hopefully streamlining some of those processes. Doesn't mean we've resolved everything, but it is now used by the entire institution as one example. If you want something new, you have to stop doing something old. So thank you so much for just listening, and there are references as well, but I'm definitely willing to take, I think we have enough time for 1 or 2 questions.
There is There is one in the, there is a question or a request in the chat that if it is possible to get a list of the links for the papers that they would like to read them. So if you can send later on a resource list.
Oh, surely, and okay, let me go to this. So here's the reference list too.
Oh,
Yeah,
my
so
God,
it's
you're
tied
ahead.
to this, and so I put it last. And thank you. Lloyd, you have your hand up.
Lori, thank you for your characteristically
Lloyd?
incredible. Whoops, can you hear me?
Yes.
Okay, for your incredibly insightful comment, but I'm actually struck with something you may not anticipate, which is that what you've described, while focused on DEI, is much bigger than that. You're actually describing what it takes for institutions to change internally so they are trustworthy and can partner with a variety of other groups so that the work that we do is with them, by them, and for them. Am I overreading your work?
No, I did not cover that because I knew this was another ball, and in full transparency, I finished my slides this morning, so I would have probably added that to it as well, Lloyd. And just for those of you to know, I mentioned this to the student-run clinic as well. Right now, the National Academy of Medicine is due on the 22nd, so it's a very short timeline. $30,000 funding opportunity for implementing elements of their principles of trustworthiness toolkit pilot project. It's a pilot project. And so that's available, and you have to have at least five partners, one of which has to be a AAMC member. The others must be community partners. So I wanted to bring that up because you all are doing such great work. Please know that that's out there.
Yeah.
Thank you, Lloyd.
I have a question, actually. I don't see anyone raising their hands. I'm really attracted by your title, Embracing the Discomfort. And you spoke a little bit about that. But I think that this is so profound at the institutional level. And what you are asking is really a profound institutional cultural change that involves discomfort, especially perhaps in the leadership and those who make things happen within institutions as well.
Mm-hmm.
Can you speak a little bit more about that?
Yes, I'll chime into the work that Lloyd and I did with years ago in 2012. I know this was 11 years ago, but with the community engagement consultative service, the CECS, which is in the Institute of Medicine report, we tried to provide a service across the 5 regions for institutions, CTSAs who wanted to improve how they did community engaged research. So we sent out a consultant, that consultant would talk with them, and then they hopefully came up with an implementation plan. The reason I'm going back that far is that the results were that while CTSAs were able to develop an implementation plan, the level of confidence was much lower that they would even be able to implement it. So there's still this disconnect, and that was 11 years ago when we did that. There's a disconnect between leadership hearing what needs to happen, whether it's because of all the fears that we talk about, to the funding that needs to go into it, to being uncomfortable to actually deal with one's own biases. And this discomfort has to be that leaders of our CTSAs have to be ready to change the workforce and be ready to share the power. And that was another piece from the paper, the fiscal readiness papers, people not being willing to share the power. So what does that look like? And are we ready to have those conversations? Are we ready to have those conversations? This can't happen without the leadership buy-in. So my thing is to say that if this is, but discomfort occurs at multiple levels. We just know that the change makers, they occur in different ways. And if we're talking about, we're now at a stage of community action. We've gone through community benefit, we've gone through community organization, community engagement, and now we're at this community action stage where we're combining Saul Alinsky's approaches to making things disruptive while we're combining community engagement as well. So to be disruptive, who needs to band together and partner or bring the hard questions to the leadership? If we are thinking about this clearly, we have to bring the hard questions to leadership with the spirit to collaborate for solutions.
Mhm.
And that has, I mean, I would think there's people here on the call that are leaders that have to deal with some uncomfortable decisions and have to deal with your own biases, have to deal with how you make decisions, or even ask yourself, are you doing research that is actually creating change, or am I funding research that doesn't lead to a change in the community that we're serving? And that's where the accountability, possibly from a larger body,
Mhm.
to making people more accountable and deal with that discomfort of accountability. I think accountability is the big piece.
Yes, yeah, I totally agree. Well, we are a little bit over the time that we were hoping to do, but we really want to thank you and appreciate
Thank you.
this wonderful, thought-provoking, disruptive information, and we you know, on behalf of our team, that you see many of the team members there and others who join us as well. We want to thank you really for sharing your wonderful work and thoughts with us.
Thank you so much,
Sorry.
Sergio. And thank you everyone for allowing me to share in that framework. And hopefully you're able to take something away from this. Please give feedback if there's things you didn't like and things you did like. I didn't put an evaluation, but you know, we always want to improve how we do this. So thank you so much. Have a good day, everybody.
Yes. Bye-bye.
Bye now.
Thank you.
Thank you.
You.
Thank you so much, Andrea.